Good morning, everyone, and happy Wednesday to you. Thank you again for joining us in the conversation of the transformation of mental health through social work and what that means. We are joined today as well by Tom, who has not been willing to not be a part of today's conversation. So this is the circumstances. So thank you again all so much for being here. We have been talking about the transformation of mental health. We've been talking about the transformation of health. We've been hosting a certificate course on Fridays from 3:30 to 5. We've been publishing articles, all of this, and having conversations with our community, both in the certificate course and with some other working groups, in order to really get a look at what is this all going to mean? What are we actually looking at? How are we going to know whether or not there's actually been a transformation of mental health? And also the awareness that that process is also going to take time to discover and to see what the outcomes are for the level of thought and work and care that is being put into the possibilities as it relates to the transformation of health and mental health. And so considering all of those different options and the inclusion of, what will research look like as it pertains to this? What is it going to look like in terms of client-related services and the inclusion of consumers of care in all of these conversations, so that we're not in many of the same circumstances that we've been in before, where it's been more of a professional centric and paternalistic forms of treatment where we are operating from, I know what is best for you. And so that's the kind of care that you're going to get. And we know that hasn't been working the way that we have most wanted it to work. So in the conversation of transformation of mental health is the inclusion of recipients of care and the acknowledgement that we are all recipients of care when it comes to mental health, and that there should also be no exclusion in terms of that, but wanting to really target the voices of individuals who are marginalized, who don't have always the access or the platform to be able to communicate what works for them. What would a transformed system look like to somebody who is part of a vulnerable population that gets overlooked when services are being put together, or getting told what it is that they should be doing, rather than really being asked, what would work best for you? How can I help you? What is it that you need versus this is what I have. Are you willing to accept it? And in not quite so generous a manner as well. So so there's lots of openings within these conversations about the transformation of health, the transformation of mental health, that really requires us to look at how to have these conversations on multiple levels, how to have these conversations with recipients of care, how to have these conversations with funders, how to have these conversations with researchers, seeing what kind of buy-in we can get from all of those different groups of individuals and more, because one, this is not something that we are going to take on alone. Two, the inclusion of multiple different kinds of groups in this conversation means there are multiple kinds of groups of individuals that are all working toward the same goal. And the conversation really also having to be about not looking at necessarily what we have done but maybe looking at the pieces of what has already been done that is working and that people do have an experience of satisfaction with, and seeing what can be added, shifted, created. And this is globally. What is done globally that really creates that kind of shift for people in the world? And how would we like to see those things happen as we continue on in the conversation? So I think that's kind of where my head has been over the last week since I was last here, and since our last certificate course session, and really thinking about things in terms of inclusion, and inclusion on a broad scope, and thinking about also what's been working, what we know has worked. And this was part of a conversation we actually had very early on in the certificate course about taking a look at globally what's working and seeing if those elements of what works could be pulled together in a way that can be more uniform and ongoingly evaluated, and to see how the things that work can be put together, rather than those things also be segmented and fragmented to only this group or that group or the other group, but really be more uniform so everybody has the opportunity for equal access. So I'm going to leave it there, and I look forward to hearing what your thoughts are. And so please make a comment below, and we look forward to seeing you all again very, very, very soon.